set out 5 tests. I set them out about 10 days ago, which said we're coming through the peak of this crisis, but until we've got, frankly, the death rate down, until we've got the infection rate down, until we can be confident that we don't end up precipitating a second peak in the virus, which would cause more deaths, which would damage the economy, which would result in a second lockdown, and as Andrew Bailey, the Governor of the Bank of England, said this week, would actually result in a big blow not just to the economy but to public confidence. Until we can be confident, based on the scientific advice, that we'll make sure-footed steps going forward which protect life but also preserve our way of life, frankly it's not responsible to start speculating about the individual measures. And I read Nicola Sturgeon's Scottish Government report on this, and it's 25 pages long, and it sticks very carefully and consistently to the 5 tests that we've set out. And so we'll be guided by the scientific advice, and we want to make sure that as we approach the point at which we can make changes, we're guided by the science, and as I said, overwhelmingly taking care of the health of the public, but also making sure we take sure-footed steps. I think anything else is irresponsible, and frankly, for all the other people that are saying that we should be setting out proposals in detail, I haven't actually seen any of those particular people suggesting specific things, and I think they're right not to at this stage, because until we've got the evidence from the scientists and the scientific groups, and also until we've tested what those proposals would, the impact they would have, I don't think it would be a responsible thing to do. It would only create more uncertainty in the public's mind when actually they need the reassurance that we're taking the right measures, as I said, based on the evidence at the right time. Look, this has been an incredibly worrying time, and the fact that we've passed that grim milestone of 20,000 of course is heartbreaking for every one of those who've lost loved ones. We know though that this has been an unprecedented crisis. I don't think you can blame the chief medical officers who were pressed repeatedly to try and put an estimate on how long it would take, how many people would pass away. What we do know is as we go through the peak of this crisis, 2 critical things have happened which were part of our plan. The first one is as we go through, we've flattened the peak because the public have followed the social distancing guidelines very carefully. That has been successful, and I'm afraid it's the reality that the death toll would have been even higher if we hadn't have introduced those measures at the right time, and frankly if the public hadn't have been overwhelmingly supportive of those measures. The second critical thing is that we've made sure we've got the critical care capacity in the NHS, the ventilators, the ICU capacity to deal with this crisis at its peak, and that means that the NHS hasn't been overwhelmed and has been able to cope not just with coronavirus but also the other critical care needs that people have. But as we come through this crisis, we're at a delicate and dangerous stage, and we need to make sure the next steps are sure-footed, which is why we're proceeding very cautiously, and we're sticking to the medical advice, the scientific advice, with the social distancing measures at this time, whilst doing all of the homework, if you like, to make sure that we're prepared in due course for the next phase. Well, SAGE do release their advice subsequent, as normally about a couple of weeks down the track, so it's properly tested and carefully checked before being put out. We don't release, as a matter of practice, the names of all the members of SAGE because the risk of them being subject to pressure, undue influence, things like that. But I don't think, Sophie, realistically, you can say there's been a lack of transparency. We've had the Chief Scientific Advisor, Sir Patrick Vallance, the Chief Medical Officer, Professor Chris Whitty, along with politicians like me, standing up on a daily basis, answering the questions, setting out their advice, and making sure that we communicate as clearly as possibly to the public what that advice is. It's overwhelmingly they're concerned that we might ease up too soon. But let me just give you an illustration. If we started proposing one or other measure that subsequently down the track we found out we couldn't implement, I think you'd be saying that we'd jump the gun. You'd be criticising us for that, and I think the public would be getting mixed messaging. So what we've said very clearly is we've set out the 5 tests for what the next transitional phase would look like. It won't be just going back, it will be a new normal, if you like, with social distancing measures adapted to areas which are currently closed off. And we'll make sure we're guided by the scientific evidence, and the scientists themselves have said, when I set out those 5 tests 10 days ago, they said easing up on any of the measures now would be dangerous and irresponsible. And they also said that in about 3 weeks' time from that point, so another couple of weeks, they'd have more evidence. And of course, the more we get the rate of deaths down, the more we get the rate of infections down, the greater flexibility we'll have. So we'll take the right decisions. But I just make this point, the Andrew Bailey, Governor of the Bank of England, made this point as well. If we take the wrong measures now, it's not just the risk to public health, also the risk to the economy, because we'd get a second spike, a second lockdown, and that would be a serious blow to public confidence. So we're going to take the right decisions at the right moment, and as I said, make sure the next step is a sure-footed one in this crisis. I don't blame you, Sophie. I've come on the show because I embrace that scrutiny. I've done the press conferences because it's critically important. We welcome Parliament getting back up and running responsibly with the social distancing and the technology to do it responsibly. We embrace that scrutiny. It's really important. I'm just also explaining to you, as along with the things that we have set out, why there are certain things that if we jump the gun, they would be irresponsible and precarious. The stage we're at with this virus, and I talked about the achievement that we've had with the public, with the NHS, in flattening the curve as we come through the peak, keeping NHS capacity so that it isn't overwhelmed, and that's really important. And the delicate stage we're at is if we ease up too soon, we risk a second spike of the virus. That would create unnecessary deaths, and that would be deeply irresponsible, and at the same time it would precipitate probably another lockdown. And as Andrew Bailey, the Governor of the Bank of England, has said, that would not just be damaging for the economy because it would prolong the pain, but it would be a blow to public confidence. So we do have to take the right steps at the right time. No one is clamouring more to get on to the second phase, where we can not just safely and responsibly protect people's lives, but preserve our way of life. But I'm also acutely conscious, because I'm talking to Chris Whitty and Patrick Vallance and getting that advice, that we need to make sure-footed steps and do the responsible thing at the right time. And so we're monitoring the evidence very carefully. We're doing all the homework on all of those areas of what the second phase would look like, and we'll make sure that we can do so and announce the detail of it where it's clear and it's reassuring and it's articulating the detail in a way that's responsible and doesn't actually end up creating mixed messages. And I think that's the responsible thing that politicians like me should do. I think we're certainly looking at that. The antibody test is important because it can tell whether you've had the virus. There's also the swab test, which says whether you currently have got the virus. We're looking at all of these measures to manage and try and bring an end to the coronavirus. There are other things as well. We're looking at the possibility of a vaccine. That's not likely to come to fruition this year, but it could be very important if we get multiple waves of coronavirus globally down the track. There's also therapeutics and drugs. It's not talked about quite so much in the media, but that's an important avenue for us to really explore and to drive forward, because of course if we could get the death rate from this virus down, and it actually, for most people, and the overwhelming majority of people, started to resemble something more like flu, it would be much more manageable. So whether it's the tests, the therapeutics and the vaccines, we're making sure we're driving forward as swiftly and as carefully as possible, so we're in the best place in the medium term to be able to manage and eliminate this crisis for good and in a sustainable way and in a responsible way. In terms of the latest figures for tests carried out, although it's a bit old now because as we come through the weekend we've got new data, our capacity for carrying out tests is now at 51,000 per day, so we've passed the halfway line to our target. And there's two things in the last week that really matter, and you always get the exponential increase in a project like this in the last week as the capacity comes on. Things which have happened which will give us confidence that we're actually on track to meet the target. First of all, with the NHS portal, we're making sure that people can access the tests either through home kits, through any one of the 31 drive-through centres, and increasingly with mobile testing labs, and the military are helping disseminate those, spread those across the country. The second thing is we focused initially on NHS workers, then on care workers. We've now broadened it to include all essential workers, and so I think we're going to see a big surge in the last week, and we're on track to hit that target. Testing is really important, not just in the way we've described before about eliminating the virus for good sustainably down the track, but also as we consider the second phase, it can help us and give us more room for manoeuvre in terms of easing up on the measures, because you can monitor very carefully who has and who hasn't got the virus. So it's really important. So first of all, I don't accept your assertion that we've been too slow to act. As I mentioned before, we've taken the right measures at the right time because we want to capture the peak of the virus and flatten it and make sure the NHS is able to cope at the right moment in time. If you go too early with your measures, and I think there'll be international experience when we're done with this crisis that will bear this out. If you go too early, you end up trying to come out of it too early, and that risks the second spike. In relation to measures at the border in terms of people coming into the country, the advice so far has always been it will make almost no impact on the spread of the virus because of the decrease in the number of people travelling and the fact that the transmission rate within the UK is high. But we've continually throughout tested this with the scientists and with the Chief Medical Officer to make sure that as the evidence changes or as we move to a second phase, we're able to take any new measures that are necessary. So that's something that we will be looking at, and it could include the testing for people coming in, it could include social distancing measures, and we'll make sure, as I said, particularly as we consider any transition to a second phase, that we're absolutely on top of the scientific evidence and are taking all the measures that are necessary to protect people's health, to protect life, but also to preserve our way of life.
We will make America great again.